Welcome to Chapter 5. I'm going to try to not talk as much with this lecture and keep it short and sweet. The skeletal system is what we are discussing this week. The textbook goes into great detail explanation, and of course, your PowerPoint also is a great reference too. Let's just dive right in. So, we're going to compare the axial and the appendicular skeleton. The axial skeleton is the central core. So, we're talking about the cranium, the rib cage, the vertebrae column, the sacrum. That's the axial. The appendicular is everything that is attached, if you will. Okay, so there's not a separate picture. I'm sorry. So, the appendicular would be like the shaded color of blue structures, the clavicle, scapula, humerus, ribs. This is not an anatomy course, so please know that I do not expect you all to memorize everything about the skeleton. However, it's good to know, especially depending on what arena of healthcare that you may be going in, to learn this medical terminology. Learn a few of these throughout the semester, through, even into next semester, quiz yourself, continue learning the different structures or the different names for the structure. One thing that I can just automatically give you, and if you just take your right hand and grab your left arm, and you can feel these two bones in your arm. So the radius bone runs along top, where like if you come right off your thumb up to your elbow, that top bone is the radius bone. The ulna is the one that's underneath. So the way I remember that, even from nursing school at the associate degree level where I attended a community college, the radius is on top, the ulna is under the radius. So the two U's, the U for under and the U for ulna, is how I have always remembered that. And I hope that will help you always remember that also, that little tip there. I will tell you platforms such as Pinterest and probably some other applications that you have on a device, they have different mnemonics and different ways to memorize the names of the bones, for example, of the skeletal system. Again, it's not required from me. This is a 1 credit class and it is a medical terminology class. So totally up to you if you want to commit all the bone structures and their names to memory. Certainly worth having a resource around like a textbook or an app or medical dictionary, whatever you choose to know the names when the time comes that you need to know the names of these. But for me, you do not need to memorize this. But again, good to know. Diving into the skull itself, several different names for the different structures that make up our skull. And here is our vertebrae in a different view. Breaks down into the cervical, thoracic, lumbar, sacral, and coccygeal vertebrae. By the way, the coccyx down there at the very bottom of that spinal column, if that were to ever break from trauma, whether it's a tumbling accident or athlete or car wreck, water sports injury, anything there, y'all, there's nothing that you can do for that. And it hurts so bad. It just takes time to heal. Kind of like a rib fracture or a broken rib. There's nothing that we can do medically to fix that. It just takes time to heal. Side note. Anyway, all right. And then the book does a great job with the anatomy layout of the pelvis. And then we have box 5.1 is just a reference of names, descriptions, pronunciations for the bones of the skeletal system. Turning the page here, bone formation. Okay, so let's talk about bone. Bone tissue, how does it grow? It is the bone forming process is ossification. So it starts in obviously when a baby's born, and then it continues into our adulthood. There's different information for men and women. We all stop growing at different times, and for women, it's a little different between each of us. It just depends on when menstruation starts, and sometimes it can even be mapped out to teeth erupting in our mouth. There's so many things, but for the sake of this course, Fibers, protein, collagen, it gives bone tissues its strength and its resiliency. Is one of the reasons why we need certain vitamins like vitamin D, vitamin B, and so much more. Osteoblasts produce the bone, osteocytes mature the bone, and osteoclasts, that's what breaks down the bone. So into your 30s, 40s, 50s, and 60s, you must maintain exercise to keep the bone formation, to keep it healthy, and you must maintain taking in whole foods that contain the nutrients that we need to continue the bone absorption, formation, all the things that the book talks about. Structure of a long bone. Again, let me just state this is not an anatomy class. I do not expect you to memorize this and know this. However, what is expected of you is if bone marrow or periosteum or metaphysicist is mentioned on a quiz or a test, you're going to need to know, where to find this information for reference. So please read this, become familiar with it for this course. Joints, woof, are very critical as young people and as we age. By the way, the synovial membrane here and the synovial fluid that are inside of our joints, the joint capsule. So, for example, I know this is a picture of a knee with the quadricep mentioned up here, and then the patella, and then we have the tibia, femur, and tibia. So that's I just know that that is a knee from my knowledge of the anatomy. But my point was I was going to say the synovial fluid within a joint capsule. If you know someone who pops their neck or pops their fingers, especially, or even if that knee does make popping sounds, stop it. Don't let them do that. That's a bad habit. The actual noise that you hear is the synovial fluid or the joint fluid releasing from that capsule, and it doesn't always get replaced. So if you happen to have a bad habit yourself of popping your fingers, stop. If you're popping your neck, stop. If you have a knee that pops, you might want to get that looked at because, again, as we age, that synovial fluid is not replaced. Anyway, that's just a tidbit of information having nothing to do with terminology. Forgive me. But the book does a great job talking about the suture of the joint, the symphysis, synovial fluid. Read all about that. Let me know if you have any questions. We here in the book we're coming to key terms and terminology. Acetabulum, articulation, atlas, axis. By the way, I can't really test you on saying things out loud unless I come up with a creative way. Maybe I'll get you to send me a recording of you saying these words out loud, but practice saying them on your own. It's important to be able to pronunciate these and pronouncing them. It may be different between different fields. Even if you've ever watched medical shows or ever attended as a patient or office staff at an orthopedics office, you'll see orthopedics, that word spelt differently throughout just the communities of Wilson and even Wake County. But again, become familiar, get used to saying these type of words out loud. Periosteum, resorption. Some of them will come very easy to you. Others may you have to practice, and that's fine. So now we've arrived at roots for bones and joints. So osteo is bone, myelo, bone marrow, or even spinal cord, chond or chondro, arthro, synovial. I just said the whole word, synovial fluid, bursa or burso, that has to do with the bursal sac or the bursal area of a joint. Those are the examples of the words. Here are the exercises that I reference. Always do that if you want to. I'm not going to require it of you. The answers are in the appendix. Here's more root word for the skeleton: cranio, spondylo, vertebrae. There's different ways, vertebrae, that you could use that root word. And another exercise here, just going through the chapter. Clinical aspects of the skeleton. So here's my example. Orthopedics in the textbook, there's no A in the word, but many doctor's offices add the A. Some don't, but many do. Health professions within having to deal with the skeleton. Oh, there's so many health professions. You could be an athletic trainer. You could be a physical therapist. You could be a radiographer that specializes in just the skeleton. Let's see what this has to say. This is talking about physical therapy school, sure. Great career there. Focus on words. that are like pictures. Yep, that does help. So this part of the chapter goes into the disorders of the skeleton, and that's actually there's six of them that will affect the skeleton and joints, and I believe that's what I'm going to have your discussion be on this week. So stay tuned for that. I will post that assignment here in just a minute. For your reference, different types of fractures. These pictures do a pretty good job. I will say that, again, Pinterest is a application that you could download and find, or you could just even Google different real live pictures of these type of fractures, and some of them are real gruesome and gnarly, and it's amazing what they can do to fix them. And some of them heal on themselves, all them all by themselves, heal on their own, and others require surgery. Let's see what else we talk about here. Neoplasms, those are never good. Joint disorders, erosion of that cartilage, joint space narrows just naturally, especially runners. Runners typically put a lot of pressure on those joints. And again, that popping and releasing that synovial fluid. Good old arthritis comes from inflammation. It can come from side effects. It can be genetic. It can just be wear and tear. There are ways to prevent that. Gout. Oof. Gout is a terrible, typically acute, short-term disease that makes people suffer the pain of where fluid shows up and there's not supposed to be fluid. That hurts. Joint repairs, you can do arthroscopy, you can do knee replacements, shoulder replacements, hip replacements. Lots of things can be replaced. Not every skeletal bone can be replaced, but many can. And the goal for any surgical procedure or bionic parts would be obviously to have a better life, more quality in living. Disorders of the spine. As you read this, please reach out to me with any questions. Here's more terminology to know. I talked about gout, fractures, osteogenic sarcoma. I actually had a dog, one of my best dogs, passed away from osteosarcoma. There wasn't anything that they could do by the time they found it. It happens in humans too. It's very sad because there's just limited that you can do because it's in the bone. More terminology, normal structure and function. These are very common. Baker cyst, carpal tunnel, very common to me. You can familiarize yourself. Okay, bone markings. What is this? Oh yeah, so sinuses. So sinuses are a part of the skeletal system, right? And this is the season of, currently we are in a high viral season, so lots of people with sinus infections. And this here shows you where like that fluid, that congestion can really land and cause problems. It's very close to our brains. Another thing about sinus infections and viral sinus issues is the proximity to our heart. People can end up with encephalitis in the brain and carditis in their heart from untreated colds, flus, viral respiratory systems. Okay, let's keep going. Oh, I'm taking too long. I'm talking so much. Okay, abbreviations are listed here on this page. I've said it before, I'm not going to hold you to a lot of abbreviations because so many facilities have their own approved or their own non-approved abbreviations. You can familiarize yourself with them. And if I were to ever ask about an abbreviation on a quiz or a test, at least you would know where to go find that information. So that's it. I hope you enjoy the review of the skeletal system. Reach out to me if you need anything.